All right, we're going to try to motor through a lot of stuff here, so keep up with me. The last video we did, we talked about why I'm going to have bad range of motion in my shoulders, and now we're going to talk about what we can do to fix it. One of the reasons we said you may just have bad range of motion in your neck. If we've got bad active range of motion, but good passive range of motion, then we probably have a motor control problem. And one of the ways we can fix that is I can use light resistance. I can try to use this band to help activate my postural stabilizing muscles, and I can retest some of my range of motion movements under better postural stabilization. We'll see that a lot of people with bad motor control get better. If there is no difference, active versus passive, you probably need some manual therapy, chiropractic adjustment, physio work, hands-on massage, whatever. We keep moving down. We said one of the other things that can mess up my shoulder range of motion is my upper back and my lat. We're going to move ourselves over to the rumble roller. So again, if I've got big joint restrictions to my thoracic spine, the gold standard, hands down treatment for that is going to be a chiropractic adjustment. But in terms of some of the self-care that I can do, I'm going to lay back so the middle of my back is on the full roller or the rumble roller. I'm going to let my head rest in my hands. We can roll from my shoulders to the base of the rib cage. Try to make sure that I'm keeping my core braced. I don't want to let my spine dump into low back extension. I'm trying to keep my pelvis neutral, my core active, and if anything, I'm trying to create thoracic extension here. So I'm looking up at the ceiling, maybe looking up at the ceiling about a foot behind me, keeping the distance between my chin and my chest constant. We'll see lots of people foam roll, but they get into the habit of bananing their way up the foam roller, pulling their chin to their chest, rounding their upper back. That's really not what we're looking for here. We're looking for thoracic extension. Once I've worked on my thoracic spine, I'm going to extend my arm out with my palm up. I'm going to rotate my rib cage about 45 degrees, and I'm going to roll from the base of my arm to the bottom of my shoulder blade and really try to loosen up that lat. Now that can be lights out painful for people when they first start to do it, so don't do it for the first time on a rumble roller. But again, we've got to loosen up all that tissue that may be keeping my shoulder from getting into full flexion. Some of the other things that we don't think about is your tricep. The long end of your tricep attached to your shoulder. So I can use two lacrosse balls taped together. I can get my arm in the gutter of the lacrosse balls, put some downward pressure, and start to work on the restrictions that exist in my tricep. I can do that arm straight or arm bent, internally, externally rotating. I can then keep working up if we found that that internal rotation test was really challenging. I have a hard time internally rotating. A lot of times that's because people have really tight posterior shoulders. I can go single lacrosse ball, just in kind of the pocket of my scapula. I'm going to sit back down, lay back down, and I'm going to work on the range of motion of my shoulder. I'm going to keep my other hand here just as a guide to make sure I feel like I'm not lifting my shoulder up. I'm not necessarily cranking it down. I just want to be able to sense that I'm not elevating my shoulder and my shoulder blade, that I'm just trying to create pure rotation from the ball and socket joint of my shoulder. So again, this could be another very tender procedure when we first start. So everything's always to tolerance. We're not trying to put so much pressure that you draw tears and make yourself cry. So that helps to loosen up postural stability issues with our neck, mild joint restrictions, and soft tissue stuff with our upper back, lats, and triceps. The other thing we talked about was thoracic rotation and extension. So if I've got difficulty rotating and extending my thoracic spine, the first thing we want to do is we can use an assisted movement. So we can go as low grade as we possibly can. One of the things we talk about is doing open book exercises, so the stability demands here are very low. I can try to stabilize my lower body as I feel one vertebrae at a time rotate from my upper body, trying to create as much thoracic rotation as I can. From laying on the ground, we're going to come up on all fours. This kind of mimics the test that we did. I can actually take a band, get it around my shoulder. The band is pulling this way, meaning now as I put my right hand behind my back, the band is actually assisting me to rotate my upper back. I can come back down. After I work through that range of motion and feel like that range of motion is starting to get better, I would lose the band so that I can see if I can actually create similar movement on my own. If I get really good at that, I can put the band in the opposite side of the room and actually start working on strengthening that rotation. So that's what's going to help create more extension rotation in my thoracic spine. The last thing now, hopefully we've got better thoracic extension, better range of motion for the shoulder. If I want to do one of my favorite exercises to help just strengthen all ranges and really help create good core and postural control, is I'm going to come really flat on my stomach. I'm going to put my hands on the small of my back, or actually probably on my sacrum. I'm going to make sure my pelvis is tilted into a neutral position, my glutes are active. I'm going to activate my shoulder blades in a good position, elevate my hands off my back so I'm internally rotating my arms, and then going nice and slow, I'm slowly going to adduct and externally rotate my arms, and the glute and core control required here is substantial. I want to feel my glutes are fully on, my core is braced as I get my arms overhead and come slow and controlled all the way down. Over time, I want to feel like I can create higher ranges of motion without having to go into a significant amount of low back extension, nice and slow and controlled, creating tension through my arms the entire way. Great exercise, one of my favorite shoulder exercises. So if you go through a little bit of all of that, there should be no reason why we can't get our arms overhead pain-free.